move on to the CSS plan. And this is drafted up prior to a team meeting with the participant and stakeholders so that we have something to talk about. All right. So when we're developing the plan, our goal is to identify the needs, desired outcomes, and interventions to address the functional limitations. We're going to document the staff member that's responsible for providing CSS services and the methods for intervention. Those are going to be on the initial plan. And then after the conclusion of services, then we'll come back to this same document to add the final outcomes that we achieved based on the interventions provided in our services code. And then we will include information about specific techniques for skill retention. So in the past, when we just were doing our best with the A1205 CSS and we taught somebody how to ride the bus, it might be 6 months before they get a job offer. They've gone through assessments, they've gone through job development. Later on down the road, they have that first job and they've forgotten how to ride the bus because they've never utilized that skill after the initial time doing that, learning that in community support services. So we really did want to make this a tool that is available and a reference for all parties so that we can all have accountability that, okay, DARS sponsored this service to help Ben learn how to ride the bus. And now we know that we have a plan for him to sustain that skill so that when he gets his job offer in the future, he's still going to know how to ride the bus and he's going to have that benefit from our efforts early on in services with him. All right, so let's take a look at our case study for developing a plan. So based on the interviews and activities that Ben's job coach completed and the assessment, the job coach completed the assessment and plan. The job coach submitted the report to Ben's VR counselor and a team meeting was scheduled to discuss and agree upon this plan. Then obviously after the plan and the team meeting, Ben's VR counselor authorized hours for services and monthly reports and direct communication were documented to document the progress and occasional challenges. So let's take a look at some of our forms. All right. So here you see the plan. So one of Ben's support needs is regarding the functional limitation of mobility. He needs to utilize public transportation. Our desired outcomes are for Ben to be able to understand the bus schedule and routes and safely ride the bus to and from desired locations. And here we're listing some very specific interventions that we intend to provide. So he's going to download and navigate the public transit app to determine the appropriate route and bus schedule based on his trip destination. And then to help him learn to safely ride the bus, the first step will be 3 accompanied bus rides. So the ESO provider will be riding the bus with Ben to and from a desired destination. The next step, and this is again in line with our goal of fading out the service and developing Ben's independence, step 2 will be to independently ride a bus to meet his ESO partner at a known location. So there's somebody going to be there waiting for him, knowing that he's getting off the bus at a designated time. And then the third step is for Ben to independently ride the bus to and from a desired destination. So you see that model and those details provided for self-direction, Ben's desire to more independently manage his appointments. He's going to be using his Google Calendar for that. He needs to relay information to his mom, so he's going to be sending her invitations to calendar appointments. And then we have a desired outcome of keeping his scheduled appointments, and mom's going to support with that. So again, we're looping in those stakeholders who are present in Ben's environment and able to help him with those things. And that's why this is such a collaborative process. And then last but not least, we're talking about Ben's interpersonal skills, developing his ability to communicate and self-advocate with unfamiliar people. And we want to help him, be able to confirm with the bus driver that he's getting on the right bus, ask questions. And so they're going to complete some very specific activities to help him do that. As you see in this pre-plan, there are no outcomes. We haven't provided the services yet. We're just presenting this in a team meeting as our intended process of working through this with Ben and helping him learn and develop these skills. Certainly, again, taking this back to the team is going to be really helpful because we want to make sure that those stakeholders are in agreement. So if Ben's mom is like, hey, I don't feel comfortable with him riding the bus, then obviously we need to amend this. So it sounds good in our heads, but we need to make sure we have buy-in from the team to make sure that if something proves not to be safe or there's a question or concern, that we have some sort of consensus on this before we spend 6 months providing a service that's never going to be utilized because it wasn't appropriate to begin with. All right. Now we're going to take a look at the report and bill, which our ESO partners will submit on a monthly basis to document the services provided and the hours billed. Right. And so you see here that this form was created to align with all of our other new ESO forms and reports. So lots of similarity here with the layout. I will draw your attention to the fact that we have sections laid out to specifically talk about each goal. So just like you saw on the assessment, we're going to individually talk about each goal here. So we have mobility, Ben's desire to learn public transportation. We want some specific details on the activities and interventions that were provided to help Ben develop that skill, what progress was made, what challenges arose, and how they were addressed. So when you have one of these blank forms, we've created space for 3 specific skills, but certainly the spaces can be copied and pasted if a 4th goal was being addressed in the same time. I'll also draw your attention to the fact that because this was an example for the first month of services, we included codes for A1205 REF, so the 2 hours of referral, and then hours for A1205 plan for that assessment and plan development and that team meeting. So because those are going to be billed at the same rate, it is okay to include both of those codes on the same report, right? And this is the final page of a sample report that is going to give some justification for continued CSS services and what comes next. So you see here that they completed the intake and plan during this billing period, and they had their meeting, they finalized the plan, and in the next month, they will move into the service period to start working on these goals, and they're going to be requesting 8 hours to begin that process. Here we have a desired outcome rating. So how are we making progress? Is significant intervention still required? And obviously for this first month, we haven't started working with Ben to improve these skills. So yes, significant intervention is still required. And then again, the hours are combined here between the referral and the plan codes, and that's acceptable because they are being billed at the same rate.